Let's say that we do have someone who overdoses on an opioid. Can one of you all explain exactly what naloxone will do, or Narcan? Who should carry Narcan?
Narcan is what we call an opioid reversal agent. In more specific terms, it competes for the same receptors that opioids do in the body, and it can cause an immediate reversal of the effects of opioids that someone may have taken. So a lot of times they will use it in the ER when someone comes in and they're down and we're not really sure of the reason why they're down. We'll go ahead and give them Narcan, and oftentimes it pops them right back out of whatever they have been put under. So, and it's very nice that we have that available to us now, and they're even doing outpatient prescriptions for Narcan now for family members and for opioid users themselves to be able to carry. You know, it's unfortunate when people get addicted, but addiction is a disease that cannot often be cured overnight. And like I said, it's unfortunate that you would be addicted, but to be smart about some of those things and to carry a Narcan pen with you would probably be the best way to go about it. Or if your loved one is addicted to something, that you would have that available to know that you had some way to treat them immediately if you couldn't get them to the ER at that moment, if you knew that they had overdosed.
So where could someone buy Narcan?
You would have to get a prescription from a physician and then go to your pharmacy and have that filled. And then I'm sure that they could, the pharmacist or even the physician could show you how to use that medication on someone.
I'd like to make a mention, though, don't run and get a Narcan right away. I'm sure the manufacturers of Narcan would love you for that, but it's an expensive drug, and it's not necessarily the first, the second, or the third choice, even when you're dealing with some mild overdoses. Most of the times, when we're dealing with the regular patient taking some low-dose pain medication, if they lose consciousness, there's something else going on. Unless the bottle is empty after they've just gotten it refilled a couple of days ago, there's something else going on. Another thing is that somebody takes a small dose of opioid and they're legitimately in pain, and somebody mistakes their loss of consciousness or any kind of confusion as an overdose. Giving them Narcan would put them through hell, because that creates an acute withdrawal which is very severe. So I would say that Narcan should be prescribed for patients who are receiving above a certain level of pain medication, and that's very simple to calculate. They're standardized types of measurement based on morphine equivalents, and we can make those decisions fairly easily. And I don't think the population at large should be concerned with getting Narcan in the house unless they've spoken to the doctor and the doctor has told them, yes, your dear one or you are taking a large enough dose to be legitimately concerned about this, in which case we're going to prescribe it. I would urge the general public not to go to the doctor and say, I need my Narcan because I'm taking a tablet of Norco when I go to bed. Don't do that, because that can cause a lot of grief and discomfort.